Hi, if you've made it to watching this video, you've probably been told by someone about NUCCA and that you should get NUCCA care. But the question you most likely have in your head is, how can NUCCA help me? Or possibly a loved one or someone you care about? Please spend the time to watch this video and I will do my absolute best to explain to you as clearly as possible what NUCCA is, why you should care, and how it can help you. First of all, my name is Dr. Kevin Leach. I am a NUCCA chiropractor here in Edmonds, Washington. On a personal level, receiving NUCCA chiropractic care as a patient has restored most of my health issues, and it's the very reason I utilize NUCCA procedures and protocols in my practice. Now, bear with me because before I explain what NUCCA is and how it works, I need to explain the goal of NUCCA and of every other chiropractic technique out there. There's a lot of misconception in the public about what chiropractic actually is. What chiropractic is and what chiropractors do can often have nothing to do with one another. This is because many chiropractic offices offer things that are not chiropractic, like weight loss programs, nutritional counseling, soft tissue therapy, laser therapies, etc. They do this because they want to help their patients. But this is very confusing to the public as to what chiropractic truly is. Some things like massage and exercise can work synergistically with chiropractic, but many people still get confused because they're not told the difference. True chiropractic is a system of analyzing and adjusting the spine in order to restore proper function of the joints in the spine, which in turn has a positive effect on the neuromusculoskeletal system of the spine, nerves, muscles, bones. The spine protects the spinal cord in the areas where the nerves come out of the spinal cord that go everywhere in the body. A problem in an area in the spine can significantly affect how the body functions. How each chiropractor chooses to analyze and adjust the spine is up to that individual doctor. There are several techniques that chiropractors can use. NUCCA is the technique that I've chosen and, like I said before, restored most of my health issues and also makes the most sense to me clinically when I compare it to other techniques. Let me finally explain what NUCCA is. NUCCA, besides being an organization, is a set of procedures and protocols to analyze and adjust the most important area of your spine, the upper cervical spine, or the upper neck, the area where the head meets the neck. This is hands down the most important area of your spine and is very unique compared to the rest of the spine for many reasons. And because of this uniqueness, NUCCA dedicates its protocols and procedures to this area because it is a study in and of itself. Let me use the model to explain why and how this area is so much more important than the rest of the spine and how problems here can affect the rest of the body and spine. Then I'll explain how NUCCA addresses this area. This is a plastic model of the head and the top two bones in the neck, atlas and axis. This is from the back and then this is from the front. Reason number one why this area is so important and why a problem with the spine in this area is a huge problem is the brain turns into the spinal cord right here, right in this area, right where the head meets the neck. The brain and the body pass all of its communication right through this area. So a misalignment or biomechanical dysfunction can affect this area. Reason number two, we have something called cerebral spinal fluid that is a liquid substance that coats the brain between the brain and the skull. Brain's in here and it just surrounds the brain between the brain and the skull. It brings nutrients, takes away cellular waste, and protects the brain. A misalignment in this area can essentially shut off that fluid flow like you would cut off running water and can cause very, very bad things to happen. Reason number three, the blood flow in and out of the brain comes from the neck. A misalignment in this area can do the same thing to the blood that it can do to the cerebral spinal fluid. Reason number four, and why this area needs to be addressed differently is because of the shape and anatomy that's so different than the rest of the spine. Now I'm going to show you the difference between the shape of the top bones and that of other bones in the spine. So as you can see here, so if we look at it this way, you can see there's a big ring of bone, that's your atlas, and then you can see this nub coming up. That's part of the second bone. Now, between the head and the top bone and the second bone, there are no discs, like you would see in every other part of the spine. Disc, bone, with the nerves coming out. It's not like that. It's not like that in the very top, where the head meets the top bone, meets the second bone. All of these reasons are why NUCCA exists and specializes in this area. Now, how does NUCCA deal with this area of the spine? Once your exams indicate that you do indeed have a problem in this area, we take extremely precise radiographs, or x-rays, to measure the exact misalignment between the head and the top two bones of the neck. It's a math and physics-based analysis and correction of the misalignment. The correction or adjustment is done in a side-lying position with no twisting. If this misalignment is causing or contributing to your health issues, then correcting that will facilitate your body to heal and restore normal function and health. Headaches, migraines, whiplash-associated disorders, post-concussion syndrome, dizziness, vertigo, trigeminal neuralgia, pinched nerve, pain, numbness, and tingling. All of these are just a few of the hundreds of different conditions that have responded to NUCCA care. There's a video below this one that gives a good overview of what NUCCA is, if you'd like to see that. If you have any questions, or if you're interested in care, call our office to set up your complimentary consultation. I look forward to meeting you. Take care, and take care of your spine. It's the only one you'll ever have.